Hello, my name is Dr. Michael Samluk. I'm an internal medicine physician as well as medical director for a hospice agency and multiple post-acute skilled nursing facilities. It's been brought to my attention that some people are still struggling with a decision regarding what to do about the COVID-19 vaccine, and they still have some questions and some concerns. So I wanted to spend a little bit of time expressing, at least from my perspective, what I've experienced and my thoughts regarding the virus and the vaccine. The last 2 years have been incredibly challenging and devastating, to say the least. Not only the amount of sickness and deaths associated with the virus, but also the isolation, depression, unemployment, financial hardships, all associated with the virus as well. To make matters worse, if it wasn't enough to be faced with the largest healthcare crisis of our lifetimes, it's unfortunately been politicized, making it more convoluted and even more confusing. From my perspective, in my personal professional experience, I've lost dozens of patients to COVID. It is the single most deadly disease that I've seen over the past 2 years. To put things in perspective, compared to the dozens of patients I've lost to COVID, I've lost no patients due to influenza in the last couple of years. Sure, there are some folks who have died, of course, from influenza, but just not my patients. So just as a point of reference. One good thing that we've learned is that the PPE, the social distancing, the hand hygiene, it all works. It works. I've been exposed to COVID while wearing PPE over the last couple of years, nearly daily. And during the heat of the pandemic, dozens of patients a day. And not a single one of my family members have gotten sick. I'm married, I've got a wife, I've got 4 kids. None of them have gotten sick. They've all been tested multiple times for various reasons. None of them have ever been positive. So the PPE works. Unfortunately, unless we want to do that forever, we need something else. Not everyone has access to PPE, not everyone uses it properly, and quite frankly, everyone's sick of it. So we need something else, and that something else is the vaccine. Now, naturally, there's a lot of skepticism regarding how quickly the vaccine was brought to distribution, how quickly it was developed. And, we're not used to things happening that fast, quite frankly. But the reality is that the vaccine and the way it works has been under development since 2002. It's been around for nearly 2 decades now. Now, granted, the specific protein isolated from the COVID-19 virus that's incorporated with the vaccine, that's unique, and that's relatively new. But how the vaccine works and the mechanism, it's been around for years. Now, there are some vaccines like measles, mumps, rubella, where an individual is injected with a weakened form of the virus in order to develop an immune response so that in the future, if encountering the full strength virus, you're protected and safe. With the COVID vaccine, it doesn't work that way. You're injected with basically a code for a protein that the body then recognizes as a foreign body and mounts an immune response to this protein. In the future, if you're exposed to COVID-19, which carries this protein, the body again recognizes it and the immune system responds accordingly. So in some respects, it's a little different than some of the traditional viruses, but the intent is that it can actually be potentially safer since you're not being injected with the actual virus. There's also a lot of concern regarding the speed, again, with which the vaccine was brought to the public. And there's reasons for that. Again, not only was it already under development for a long time, but funding was made available to the manufacturers so that they could gear up for production in parallel with the trials being performed. Traditionally, a manufacturer wouldn't put itself at that financial risk of gearing up for production until they were absolutely certain that their product was going to pass all the trials. But in this case, that financial risk was alleviated by them being provided the funding so that they could do it in parallel without risk. And that saved a tremendous amount of time. I get a lot of questions regarding the vaccine, such as, can I get COVID-19 from the vaccine? Well, like I already said, you're not being injected with the virus itself, so no, you can't. You cannot get COVID-19 from the vaccine. You're being injected with coding for a protein and not the virus itself. I've been asked, can I get an adverse reaction to the vaccine? Of course. Of course, people get sore arms, fevers, chills, sweats, aches. It varies. It varies, but usually these symptoms are limited to 24 to 48 hours. Like I said, some people just have a sore arm. Other people have been down and out and kind of useless for a couple days. That's the body's immune response. And that's an indication that it's working and your body is reacting to it. Oftentimes when we're sick, it's our body's immune response that makes us feel ill as opposed to the actual virus, bacteria, or whatever the foreign body may be. It's our body's immune response, and that's what you're experiencing. But even at worst case, a couple days being down and out is far better than being in the hospital and heaven forbid dying. So it's a trade-off well worth making. I've been asked, can you still get COVID-19 even after you've had the vaccine? Yes, you can. You can. No vaccine is perfect, although this one is pretty darn close, relatively speaking. But no, nothing's perfect. I will say this, that the dozens of people who I've had hospitalized and have died from COVID-19 have not been vaccinated. Everyone I know of who has been vaccinated has had relatively mild symptoms. They've experienced essentially like a cold. They may have had some fevers, some malaise, but relatively mild. And quite frankly, I expect that's probably what the future will hold for us. You know, the coronavirus is the virus associated with the common cold. And I'm hoping that through vaccinations and time, that will be our response to COVID-19. In the future, we'll be vaccinated, we'll be protected, we'll be exposed to COVID-19. Sometimes we'll be symptomatic and it'll be a cold. And that'll be it, just like the common cold today. Doesn't require hospitalization, doesn't require quarantining. You use your hand hygiene, you stay away from folks as best you can, and you go on with business. Hopefully that's the way the future will be. I've been asked about the variants and changes. You know, just like the influenza vaccine is modified year to year based upon the prior year's influenza virus and strain, it's reasonable to think that something may be true for COVID and that we may need our boosters periodically. How frequently? Don't know. I've got my first booster already, and I expect to be getting them in the future, to be frank. I think that'll just be part of our health maintenance. These are all very good questions, and there are many others out there that I haven't answered, but would be happy to if need be. The biggest piece of advice I think I can give is that you need to educate yourself, and most importantly, you have to be very, very aware of your resources. Like I said, unfortunately, this has been politicized, but I'll tell you, the CDC, the National Institute of Health, the New England Journal of Medicine, these are credible sources. Your Aunt Sarah's cousin's brother's friend on Facebook, while you may trust this individual, their sources may not be credible. You got to know where the sources of the information you're receiving, you need to know where they're coming from. It's very important. You know, like I said, the choice to be vaccinated has been very easy for me. All my family members have been vaccinated, except for one, my youngest daughter, who's 11. has received her first dose and will be getting her second in a couple weeks, and she's excited. She's very excited. She's sick of wearing masks. She's sick of being quarantined from school and from soccer and from missing activities and events that 11-year-old girls don't want to miss. She's excited. She's very much looking forward to being fully vaccinated. Um, Now, again, I have the advantage of having access to credible sources of information, so it makes the decision for me much easier. Um, but I'll tell you, the decision for me personally wasn't so much about myself, because thankfully I don't have a lot of those medical comorbidities, the heart disease, the diabetes, the kidney disease that would make me susceptible should I contract the virus, and more likely to have a poor outcome. Thankfully, I'm not in that situation, but more so than for me, it's really in my mind for my family, my patients, and others in the community who I may come in contact with. Because I'll tell you, I don't know how I would cope with the thought of me having a choice to be vaccinated and protect myself and others around me from the virus, choose not to, and then find out that I later gave somebody the virus and they had a poor outcome and died. I don't know how I would cope with that. Yeah, I don't. I don't. Um, to me, again, the benefits so far outweigh the risks. It was a no brainer. It was a no brainer. Um, Now, the reality is, part of your decision process is going to include your employment. That's part of it. And that's one of the trade offs you have to make. Um, Hopefully, we can lay some of your fears and concerns, so that the choice is an easy one, one way or the other. One way or the other. And I would respect your choice, but if you have any additional questions, concerns, please reach out to your administration. They can get in contact with me. I'll try to, like I said, answer any further, more specific questions if I can. I want everyone to make an informed decision. So, good luck with your decisions, and I hope everyone is well. Thanks.